Hey everyone, and welcome to This Explainer. I am so thrilled to have you here with us today. If you've ever felt completely overwhelmed trying to navigate the maze of government healthcare coverage, and let's be honest, government bureaucracy isn't exactly known for being simple, you are absolutely not alone. Today we're breaking down a really valuable educational seminar presented by TCS and Associates. They are trusted Medicare resource specialists dedicated to providing top-notch guidance, support, and care. Our goal with this explainer is to take all that complicated, jargon-heavy information and basically transform it into a clear, structured roadmap for you. We're going to clarify the core differences between Medicare and Medicaid, explore exactly how they work together, and look at some incredible assistance programs that could significantly lower your healthcare costs. So get comfortable and let's unravel this whole shebang together.
Here is a quick look at our roadmap for today. We'll kick things off with Medicare versus Medicaid explained, move right into understanding dual eligibility, then cover Medicare savings programs and extra help for prescriptions before wrapping up by reviewing your coverage options.
All right, Section 1, Medicare versus Medicaid explained. Let's clarify these foundational healthcare programs.
Let's start right at the base of the mountain and define the two primary programs that honestly cause the most confusion. What exactly is the difference between Medicare and Medicaid? It seems like such a simple question, right? But the professionals at TCS and Associates tell us that this is literally one of the most frequent questions they hear from folks trying to navigate their healthcare. Because the names sound so incredibly similar, many people are genuinely surprised to learn that they are in fact two entirely separate programs serving completely different purposes.
It really helps to draw a clear line between the two. Think of it like this. Medicare is a federal health insurance program. Eligibility here is generally based on your age, specifically individuals age 65 and older or your disability status. That includes certain folks under 65 with qualifying disabilities and stage renal disease or ALS. Notice that Medicare eligibility is generally not based on your income. Medicaid, on the other hand, is a joint federal and state program. Its primary purpose is providing healthcare assistance to eligible individuals based on having limited income and resources. And because it's a joint program, Medicaid rules and programs actually vary from state to state.
When we look at their coverage side by side, Medicare helps with your standard healthcare services. We're talking hospital care, physician services, preventive care, specialist visits, medical equipment, and eligible prescription drug plans. Medicaid steps in to provide a totally different kind of safety net. Depending on your state's eligibility, Medicaid might help cover general medical expenses, but it also heavily features long-term care services, prescription costs, and crucially, Medicare-related expenses.
Moving right along to Section 2, Understanding Dual Eligibility. Let's look at how these two programs coordinate.
Okay, so we know they're separate, but what happens if your specific circumstances mean you actually qualify for both of them? Well, the specialists at TCS and Associates want you to know that this brings us to a super important term, the dual eligible beneficiary. Being dual eligible simply means you meet the age or disability requirements for Medicare, while at the exact same time you meet the specific limited income and resource guidelines for Medicaid. For these individuals, Medicaid essentially steps in to provide assistance with certain healthcare costs that Medicare alone does not fully cover. Now, the exact level of assistance you get will vary depending on your specific eligibility category and your unique circumstances.
So how does that actually play out in real life at the doctor's office? It's basically a simple two-step coordination process. Step 1. Medicare generally pays first for covered services. They act as the primary payer. Step 2. Medicaid may then help pay certain remaining healthcare costs. The absolute crucial takeaway here is that these programs coordinate. They work together seamlessly for eligible individuals to help significantly reduce those painful out-of-pocket expenses.
All right, Section 3, Medicare savings programs, additional assistance for Medicare costs.
Now, you might be wondering, what if I don't qualify for full Medicaid? Am I just totally out of luck? Well, not necessarily. Many people are completely unaware that specific secondary programs even exist. They're called Medicare savings programs. If you are eligible based on state and federal guidelines, these programs can be a massive financial relief. They might help cover your Medicare Part B premiums, your deductibles, your copayments, and your copayments. Just imagine the relief of having help with all those out-of-pocket costs. Keep in mind, though, not everyone qualifies for this, and your eligibility can absolutely change over time.
Let's head into Section 4, Extra Help for Prescriptions, Reducing the Burden of Medication Expenses.
Let's pivot for a second and talk about what is often literally the biggest, most stressful healthcare expense for Medicare beneficiaries, prescription medications. The average older American can easily spend hundreds, sometimes thousands of dollars out of pocket on prescriptions every single year. That's a huge burden.
And that brings us to the Low-Income Subsidy Program, more commonly and affectionately known as Extra Help or LIS. This program is specifically designed to assist eligible individuals with their Medicare prescription drug costs. With pharmacy costs seemingly rising constantly, learning about this Extra Help program is absolutely essential.
The immediate impact Extra Help can have on a household budget is absolutely huge. Depending on your eligibility, this program might reduce your overall prescription drug costs, lower your monthly drug plan premiums, shrink those annual deductibles, and even lower your co-payments for covered medications right there at the pharmacy counter. For eligible folks who take medications regularly, this provides deeply, deeply meaningful assistance.
Finally, Section 5. Reviewing your coverage options. Navigating changes in your healthcare needs.
We've covered a ton of ground today, and because federal and state eligibility rules are notoriously complex, it is crucial to proactively manage your situation. You should regularly be asking yourself these key questions. Do I qualify for Medicaid? Am I eligible for a Medicare savings program? Could I qualify for extra help with my prescriptions? And perhaps most importantly, has my eligibility changed since I last reviewed my coverage? If you've recently experienced any kind of shift in your income, or if you've been prescribed new, expensive medications, these are exactly the questions you need to be asking yourself right now.
I want you to remember this fundamental truth. Actually, scratch that, it's more like a rule of thumb. Healthcare needs change. Income circumstances may change. Program eligibility requirements can change. Life is not static, right? And your healthcare coverage shouldn't be either. As your life evolves, the assistance programs you qualify for may evolve right along with it. This is exactly why personalized education and periodic reviews of your healthcare coverage are so vital. Education is your best tool for making informed decisions.
Now, as a quick educational disclaimer, it is really important to clearly state that eligibility for Medicare, Medicaid, Medicare savings programs, Extra Help, and other assistance programs is strictly determined by applicable federal and state requirements. The benefits, costs, and availability vary widely based on your unique individual circumstances. But here's the really good news. You do not have to figure this out alone. You don't have to be a healthcare expert to get the help you deserve.
And that is exactly where the professionals come in. TCS and Associates are completely committed to helping you understand these exact programs. For personalized, educational guidance that's tailored specifically to your unique situation, please reach out to the licensed Medicare professionals at TCS and Associates. You can call them directly at 210-899-4626 to discover what assistance you might be eligible for today. Once again, grab a pen. That number is 210-899-4626. So I'll leave you with this final provocative thought to consider. How much money might you literally be leaving on the table simply because you haven't checked if you qualify for these assistance programs? Don't let a little bit of confusion keep you from the support you might be totally entitled to. Thank you so much for joining me on this explainer. Stay curious and take charge of your healthcare.